Uh, let's just go to the introduction. So every day we come into potentially poisonous things every day. Poisonings affect 2 million people per year. Chronic poisoning is more common. So poisoning like over time rather than like acute all of a sudden. Deaths by poisoning are rare. With implementation of like the safety caps for kids, um, and older people. But like drug abuse is a huge issue, which is or overdosing. Uh, so that's on the rises. That's so identify the patient and the poison tox. It's poisons any substance whose chemical action can damage the structure of the body. And it's different ways that we can take these in. Like, remember years ago, people somebody was sending Congress letters with anthrax powder on it, and all they had to do was like open the letter and inhale, which comes from farmers, like manure and stuff like that. Substance abuse is a cause. Overdose, a toxic dose of a drug. Like so, antidepressants could be one. Um, your primary responsibility is to recognize what type of poisoning or that poisoning has occurred and what it was. Pay attention to your surroundings. So if you get called to like some like say a feed store and there's like people all over kind of like vomiting everywhere, or just passed out, or any place like there's a bunch of people not acting right, I would be very suspicious of what's going on. Uh, Various amounts of some poisons can cause considerable damage or death. And the signs and symptoms of poisoning vary according to the specific agent, like organic phosphates, which we're going to get into. It's causes a very particular signs and symptoms. So this talks about like some of the like overview opioids, hypoventilation or respiratory arrest, where they kind of just slow, shallow breathing, so they're not getting that oxygen in like they should. Their pupils come like a pinpoint. Rather, if they're on a stimulant, their pupils are blown. So they're kind of like in a coma or like completely out of it, and they're usually like hypotensive because they're dilated their vascular system. Some pathomimetics, uh, kind of like epinephrine, like it mimics the sympathetic sepsis. Remember the sympathetic nervous system, feed or breed, fight or flight. So people are going to take like uh, cocaine, methamphetamine, which speeds up the that process. And so their pupils are going to get blown. They're just going to be tachycardic, like agitated, um, and hyperthermia. Like if somebody's like having psychosis due to a stimulant, they could like end up dying from all that. Sedatives, um, slurred speech, sedation, hypoventilation again, and and anticholinergic. I can't say the word very well, but so atropine, which kind of takes um, speeds up the heart, so you're gonna have tachycardia, hyperthermia, and like hypertension, dilated pupils. Uh, can cause sedation, coma, delirium, and decreased bowel sounds. Um, and cholinergic, that word. So that's just phlegms. So that's when excess of everything. We're gonna like people are gonna be salivating and sweating. Uh, lacrimation, so they're gonna be teary eyes. Like everything's just gonna be kind of hypersensitive. Urinating, defecating, or diarrhea. Cramps, vomiting. So that's like with the feed store, if you see that, like weed killer or in pesticides and stuff like that will cause that. Identify a patient with poisoning. So you ask the patient, what did you take? When did you take it? Why? You don't really ask why if they're suicidal. No, obviously could be. It's like they took a bunch of meds. Like how much of this substance did you take? And like always take the pill bottles with you or that substance, but make sure you wear gloved hands. Like your hands are gloved, of course, so you don't want to be touching any of that. Um, so if it's like somebody OD'd, did anybody give them Narcan or any other antidote? And it's good to know how much a patient weighs as well, and especially if they go unresponsive and uh, like in the ER or whatever, they have to give weight-based drugs or how much they're going to metabolize that particular poison. Uh, so like try to determine the nature of the poison. So if like again somebody's like playing in the garden, all of a sudden they're unresponsive, and there's like pesticides around or weed killer, uh, uh, it could be organic phosphate poisoning. Uh, I guess to take it with you, so you can show the ER, or they can send it to the lab, or they're just gonna do blood work, but make sure it's like in a closed container. Like if you smell almondy smell, I guess that's some type of poisoning.
Could you just take a picture instead, and instead
I
of
would take
taking
a
that
picture
poison with you?
instead. Yeah,
What's that?
I would probably take a picture. You could.
Yeah.
You don't want
Gotta
to
have
handle that
that.
too much.
Yeah.
But yeah, like or containers on the scene or bags. Um, so if a
You talk
patient
about
vomit,
you
go
talk
ahead,
about
Kevin.
smelling almonds,
Yeah, what is that? Okay.
cyanide poisoning.
Yeah, there you go. Cyanide poisoning, and
But
it's
what's
usually
interesting
it's
is
too late.
is only like 50% of the population can smell almonds. We
So
could do that right, but it's cyanide poisoning.
I don't know what almonds smell like either. So
Yeah, exactly.
uh, so if a patient vomits, examine for pill fragments. No, document anything unusual that you see. So there's like any which way you can think of poisons can be introduced to the body. Um, inhalation, absorption, like through the skin, eating it, or for like drugs, injection, or it can be any whatever thing for injections. Uh, years ago, there was a thing called detergent bombs that people would make. Like this, when I was like looking over this chapter, like they would sit in their car and tape it all off, and then they'd mix these like common chemicals in their car, and it would just kill them, like in the car. And if the firefighters broke it open, it would kill them too if they didn't have SBA on. Um, so that's called huffing. Uh, for the first one, so like topical. It could be like a granite force phosphate poisoning or anthrax or whatever for skin, like uh, ingestion for pills or anything, botulism or salmonella. He's doing that all wrong. Anyways, move the patient to fresh air immediately if it's like uh, scene safe first, then move the patient to fresh air immediately if you can. If there's some like carbon monoxide poisoning, I would stay right away and let the firefighters do with it. And that's when that we have that little red thing that goes off for detection. Yeah, so if there's toxic gases, like if you pour bleach and um, what is it, ammonia together, that will be toxic. So if like powder or whatever, they need to be decontaminated before they can be transported to the hospital, or they will be decontaminated out in the ER, and you will be auto service for a while. And you don't want to inhale any of that stuff into your lungs either. But just give supplemental oxygen as much as you can, and make sure that you're able to suction. Some patients, yeah, or talked about this. Some patients may use inhaled poisons to commit suicide in the vehicles. So they just talk about exhaust fumes too. With the catalytic converters these days and whatever, that's pretty hard to do. I guess it still can be done, but older vehicles, they could like pipe in the exhaust into the um, car and just turn it on and take a nap permanently. What was it? Office Space. They tried to do it. So absorbed through the surface of contact poisoning. So like anything, like any opening is called a mucosal membrane. Like so the eyes, the sphincter, the mouth, nose. So that can be absorbed in any of those areas, like powders or whatever can get in and cause like all sorts of nice things. And on your skin as well, chemical burns, rashes, like so distinguish between contact burns and contact absorption. I guess there's gonna be irritation. Signs and symptoms is a history of exposure, liquid or powder on the patient's skin, burns, itching, irritation, redness of the skin. So like what borax, that's what it is. I was thinking that's I guess it's outlawed in a lot of places, but it's like a normal cleaning thing for us. But like you blow that in somebody's face, it's not going to be very good for them. So like you want to brush it off as much as you can. If they have to take off their clothes, you give them like a sheet or something to put on. You don't want to get that stuff on you in an ambulance or into the ER. Flush and wash your skin as much as possible. Like put the stuff in a bag, like a plastic bag or a biohazard bag, so it doesn't get everywhere. Dry powder has been spilled, brush it off the powder area, like with and then flush it with water for like 15 to 20 minutes. We won't be doing that in the ambulance. So like we carry some stuff for flushing, but it won't be like you can do a little bit. But if it's over a larger area, would have to go to the decon unit in the ER or get the fire department involved, which I'm sure they would be there anyways. And they'll set up their hazmat issue and decon them right there with a shower. So that what they're doing here is flushing the eyes out. If there's like if somebody got borax in their eyes or whatever, um, so they have the nasal cannula hooked up to like probably saline or sterile water, like in a jug, and it's just flushing the eyes out, and they're like forcing their eyes open so they can't clench them shut, um, to get all that stuff out of the eyes. And there's like you should be flushing it for like 20 minutes if you get stuff in your eyes like that, or the patient. Chemical burns can be occur in industrial settings, and they should have these safety sheets. I can't remember what they're called off to learn like anything that's any chemical to be able to decon.
Yes.
What's that?
SDS.
Yes. Material safety data sheets. Yep. So so we know how to, and the ER knows how to like handle the patients properly and how to decon against whatever substance it is.
The good thing,
and-
good thing, Morgan, is a lot of places that have those chemicals and stuff there. Per OSHA, they're supposed to have safety showers and all that stuff. So hopefully they have eye washes and they're doing that already before you get there. You know,
Yeah.
And the same with SDS sheets. You know, they're supposed to have, you know, if you have a bunch of chemicals in your building that aren't like just WD-40 and Windex and stuff, you're supposed to have an SDS sheet available. You know, you're supposed to have it available. You know, to be able to give to somebody like yourself.
And they should be like every employee is supposed to know where they are, or they should be able to get it on the way out. So 80% of poisoning is done by mouth. Like household cleaner. Where did I hear something like? Didn't somebody say like a week or two ago somebody was ingesting bleach? It was a call in Maine. Wasn't it Fred that said something about it? Maybe. Either way,
It's a call in freedom.
What's that? Oh, Call It Freedom.
Yeah, it was an
so
old lady drinking bleach.
that'll do a number. So liquids, like even water could be poison if you drink too much of it. Household cleaners, contaminant like botulism, salmonella. I don't know, my wife is listening. Plants and medications, like especially kids who thinks like pills or Skittles. So ingested poisoning signs and symptoms include burns, like around the mouth, if stomach pain, vomiting. So if it's like a tricyclic antidepressants will cause dysarrhythmias, or a lot of antidepressants will cause dysarrhythmias, and it could cause seizures as well. So treat the signs and symptoms. Notify poison centers. So I don't know off the top of my head, but so if you have something and they don't have a safety data sheet, maybe if it's at home or whatever, you can call the poison center, or you can call your medical control and they can call poison center if they have any questions. So yeah, if like it's still on our protocol for activated charcoal, which is a binder. If you ever, and this, I'm sure that's going to be on one of your questions. So if somebody like takes a bunch of medication and it's recently, you can give them activated charcoal, which is like just liquid charcoal, like stuff that you burn. They drink it and it binds to the medication, so it doesn't get absorbed through the GI tract into the blood. Yeah. So there it is right there. Actidose. So that makes people throw up, which is something that we don't want to do. Right? Oh no, that's charcoal with actidose in it.
Yeah, all three of these were charcoals that they explained in the chapter.
Oh, they are? Okay.
Those were the names, I believe.
Oh, okay, thank you.
Talked about in the chapters.
So yeah, activated charcoal is liquid. Usually you have to put it in a cup. I've only had one patient, like, and she was kind of a psych patient. Love the taste of charcoal, like activated charcoal. But once if they throw it up, it stains bad. You're never getting it out. Injected poisons, like drug abuse. So like also bees, wasps, scorpions can cause poisons like that are injected. And there's like a type of drug, what was it? Alligator heroin? I think it was more down south, like they would inject themselves, but then their entire arm would like turn scaly and rot off.
It was crocodile.
Crocodile, thank you. Yeah.
Yep.
So that was more down south. That didn't work its way up north, did it? Like in New England.
They had a couple cases in Manchester, but not many.
Yeah. So, and I don't think there was really
People realized it was actually bad to do.
for once. So it cannot be like we can't dilute it or remove it from the body. We can like for opioid overdose, we can give Narcan, but otherwise than that, it can cause like intense local issues depending on what type of venom it is. It will cause like neurological deficits in that area or musculoskeletal issues. So signs and symptoms of injected poisons may include weakness, dizziness, fever, chills, like altered mental status and unresponsiveness. And we're just going to do supportive measures, monitor the airway, provide high flow oxygen, like keep their sats above 94, below 100. Make sure that if they're nauseous or vomiting, that we make sure maintain their airway. And if they get like caught on their, I mean, anything like in their arm, like extremities, upper extremities, you want to make sure you remove their bracelets and their watches or rings, because you don't want what is it called? Oh my god, it's too late for me. Like where you won't be able to like it'll swell up and it'll cut off circulation, and it's really bad and it's painful and like they'll lose that appendage. It's gonna come to me in a minute. And we'll definitely get into it anyways down the road. And another, so we're gonna do standard precautions. Scene safety BSI. Is there any like we're gonna look for any odor in the room or anything that's maybe say like propane or almonds or anything that's off? Are there a bunch of medication bottles laying around? Is there like are they half full? They're just like like I've been on calls where like we checked the dose like the date they were filled and then we started counting how many pills were left in them. Alcoholic beverages because even if it's not on purpose, like some alcohol will potent like make it that drug more potent. So like syringes, paraphernalia, or anything. Suspicious drug, suspicious order that indicates a drug laboratory. I've been there, done that. So we want to do our general impression, sick or not sick. The alert oriented? Are they alert to verbal, painful, or completely unresponsive? Are they going to die anytime soon, or is there something I can fix or need to fix before they die to keep them from dying? Again, and just because they're talking to you, they could be compensating, or they just may not even know that they're altered. So just you make sure, like, do you know what day of the week it is? Do you know what month it is? They might get irritated or like think you're being foolish, but it's important to know. Ensure their airways patent and they're breathing properly. If they're too fast, we got to breathe for them, like slow it down or talk them down or use a BVM. If they're too slow, again, we're definitely going to use their BVM and like whatever we need to do to keep their SCO2 above 94 and below 100. For circulation, we're going to check for skin color, condition, temperature. Like, is there pale, pink, dry, diaphoretic? And there's like the skin's the biggest organ, so whatever substance it's the issue, it's going to tell a lot of tales. And we're going to make a transport decision. D. Where's going to be our? Oh, there it is, the XABCs, and I did not look it up. Kevin, what's the XABC?
I believe it's hemorrhage.
I was gonna
Yeah.
say when I looked it up, it says hemorrhage for bleeding.
That's what I did
Yeah.
too, but for obvious alterations. Oh yeah, wouldn't that be under C though?
No,
Okay.
because now they're saying that if the patient is actively bleeding, like severe hemorrhage, stop that before you fix the airway,
Right.
because if they bleed out, they're already dead.
Yeah, but in toxicology though, they're just putting an XABC for everything.
Yeah, I'm not happy with certain things they're putting in some of these lectures, but we just kind of go around them.
Okay, so hemorrhaging is X. We gotta fix it. Everyone who's exposed to hazardous material must be thoroughly decontaminated by a hazmat team. So if you enter a scene and unknowingly, then you realize it's hazardous, you've got to go through the hazmat team to get back out. So again, history taking, we're going to investigate the chief complaint. We're going to do the sample history, signs and symptoms. Do you have any allergies, any medications that you've taken? Pertinent past medical histories, last oral intake, and events leading up to. This could be anything. And for somebody who has like food poisoning, they might even know that they were poisoned. If your patient's unresponsive, obtain history from like bracelets, wallets, their medication list, bystanders. If you can look up their old charts if you've had them before as a system. So like in addition to sample, we want to know what substance was involved. So if it was pills or food or whatever. And when did the patient become exposed to it? How much did they ingest? what was the level of exposure for like powder or a gas? Over what period? Was it like a long time were they exposed to the substance, or was it not enough, or just a little bit? How's the patient or bystander perform any intervention? So if like somebody OD'd, did they give them Narcan to reverse the opioid? And a lot, like last year or two, I've noticed that like when we go to ODs, that they'll put like ice over the patient or like frozen food to try to arouse them. Not that it always works. So how much? So then we also could create another problem of hypothermia. How much does the patient weigh against, like how potent is the med or whatever the poison is, compared to how much the patient weighs? And also for if like we have to give any weight-based drugs in the ER. Any questions so far? No. Okay.
Nope.
So we're gonna look at for physical examination. So if there's like any powder or whatever, or like we're gonna look for the airway if there's any swelling or any redness around the mucosal membrane. Um, if they're salivating a lot or just right, or if they're completely dry. Um, if, like they have powder on them, we're gonna look for like irritation, like redness, burns, like what stage of burning. Also get a baseline set of vitals, like always. So like we in the ER, and the further they go down the line, they'll compare the back to the baseline set of vitals in any intervention that we're doing, or if they're getting better or worse. It's good to know. Reassess the accuracy of the XABCs. Repeat vitals every 5 to 15 minutes. 5 for unstable and 15 for a stable patient. So treatment, again, supporting the XABCs. So if they're hemorrhaging, stop the hemorrhaging. If the airway's not patent, make it patent. Like if they're like have toxic substance and their mouth is swelling, that's you might want to let the ER know or get ALS involved, because it's almost like anaphylaxis. You don't want to let that go. So if they're breathing too shallow, like you're gonna need to maintain their oxygen levels in their circulation. Contact medical control or the poison center. We shouldn't have like the poison center's information, but you can always go through 911 or contact medical control and they'll get them for you. Because sometimes, like there was a call I went on where a kid ate melatonin, like an entire bottle of melatonin, and caused call poison control. And they're like, "Yeah, fine, we'll sleep it off." But there are times that you can't do that. Manage your airborne exposure level with oxygen. Like if you have them on oxygen, like put a mask on them if they have to aerosol that, or put a HEPA filter on. Remove contacts, because if they're have that stuff in their eyes, it'll get underneath their contacts, or they'll just start swelling up and it'll cause aggravation. And consider, we can always consider any meds. So any ingestions, we can consider activated charcoal. And I would talk to medical control. That's the one med I'd call, or because there's certain times you can give it, certain times you can't. Report as much information you can to poison control or chemtrail or to the hospital. Again, like we talked about earlier, bring the medical material data sheet to the hospital. So because they're going to be ultimately looking at it too, looking at to take care of the patient in the best way. So again, we're ensure scene safety and BSI, like any scene, any scene safety BSI. We're gonna, if there's any tablets or like we're gonna clear the patient's airway. We're gonna wash or brush the poison. Like we're gonna brush, if it's powder, we're gonna brush it off first. Oh yeah, we got gowns and stuff in the ambulance too that are required. Um, so brush that stuff off. I would change the patient's clothes if that's on their clothes. Let's put them in a gown or a sheet or something. Assess and maintain XABCs, control bleeding, circulation, airway. Provide oxygen if they're like at 90, we're gonna give them nasal cannula. If they're at 80, we're probably gonna put them on a non-rebreather or check what their rate or quality of respiration is. So if they're like breathing kind of shallow, we're gonna use a BVM. Treat for shock. So keep them warm, talk them down. Put them in Trendelenburgs if you can. Plenty of blankets. Did we go backwards? No. Okay. I guess this is for like oral. So activated charcoal binds. Remember that word binds. To specific toxins. Like if they're pills or medications, it will bind to so it'll pass through into a stool. I bet that is messy. Instead of going to the GI tract. Contraindicated in patients who have ingested like alkali poisons, cyanide, ethanol, which is really kind of, I guess, toxic, lithium, like anything that would cause burns or whatever. I don't know why anybody would want to do that. Mineral acids, like, and just call medical control. Just like even it depends on how long before they've taken the poison before you can give it. A decrease of LSD cannot protect their airways, another contraindication. So it's 50 grams of activated charcoal. So it comes in 50 grams of charcoal. So for adult or kids, it's 1 gram per kilogram of body weight. So you might, if for a big guy like me, you're gonna need more than one bottle. So if we have a kid, like I heard of the example, so 55 pounds, and then you take the pounds and divide it by 2.2, so it'd be like 25 kilograms. So you'd give 25 grams of activated charcoal for the kid. We put it in your sippy cup. Make sure you shake the activated charcoal once you got approval, because it's like, I guess, settles. So you want it all mixed up and before they give it. Like I guess the best way is to put it in a cup and then a straw. If the patient refuses, like document. Because I'm sure they can refuse and just like throw it at you. Side effects of activated charcoal is constipated and black stools. If the pot they activated charcoal does make them nauseous and they could vomit. They will vomit. So over time, a person routinely misuses a substance or like even meds, like pain meds. They develop a tolerance for it, or like if they're in legit pain and they develop a tolerance, they're gonna have to increase that amount of meds to get the relief. Or if they do become addicted to it, um, they're gonna need it. And if they can't get it from the pharmacy or whatever, they're gonna get it other way places. Uh, like with the opioid epidemic, people were like blindly taking opioid drugs for uh, pain relief, analgesia, and then get hooked on it and then start like it does, like it's proven that it changes the brain makeup of the medulla, and so they'll do whatever it takes to get that relief, and if they'll take other drugs or whatever to get that high, or not even high, just relief. um Safety awareness for standard precautions can be overemphasized. Known drug users are fairly high incident hepatitis and HIV. Anybody that ever deal with in a prison usually has hepatitis from needles. So alcohol, many calls for service has connection to alcohol use. So it causes like intoxication, causes altered mental status, slow reflex. It's a depressant, so it makes you slow down. It causes if you take alcoholics can get like cirrhosis of the liver, or if you drink a lot of alcohol, you don't even have to be alcoholic. It will can cause cirrhosis of the liver or hypertension. So again, that's like the chronic use of alcohol. It's a CNS depressant, decreases activity and excitement, induces sleep, dulls the senses. Like I think we all been there. May cause aggressiveness, inappropriate behaviors. The mean drunk. Sometimes they don't become happy drunks. Sometimes they become mean. And also, alcohol increases the effects of other drugs like opioids will potentate the effects of like fentanyl or morphine, or if they're on anti-seizure meds. Or cardiac meds will do a number on them too, or diabetes. So if a patient exhibits signs of serious CNS depression and respiratory support, may cause vomiting if you drink enough. Patients may experience frightening hallucinations or delirium tremens. TTs are so that's like one, like when people someday like alcoholics will eventually just like decide they're gonna quit. And that is one thing that will kill people. Withdrawals will like alcoholic withdrawals will kill people. So they have to go through a process. And it will cause like agitation. They will seize, fever, sweating, tremors, confusing, and disorientation. Because like your brain and your kidneys are used to this substance in them all the time, and then once it's gone, like it doesn't know what to do with itself. And yeah, it shuts down the kidneys and the brain. Just it's not good. Any questions on alcoholism? No. Oh, so opioids. We've all been there. Well, not there, but we all know it's a problem right now. It's a type of medication, relieve pain. Opioids is a subset of the opioid family. It's like morphine's natural, but or non-synthetic, but fentanyl's like a synthetic, like it's made on its own. And like poppy seeds, opium comes from poppy seeds, which codeine and morphine are derived from. So codeine is like once it works its way through the liver, it becomes morphine. So here's just a list, excuse me, of different types of opioids and drugs. Um, prescription opioid drugs among the most commonly abused drugs, because they're addictive. But there are other drugs out there that aren't as addictive or at all. But some people become dependent even with prescriptions. They're kind of like alcohol. They're a depressant. So and tolerance will develop. So like it's kind of the same things as alcoholism. Some users may um experience like a massive high. So and the interesting thing is when people like will develop these tolerances for it, but then they'll, for whatever reason, will stop for a while. They're broke or they just want to quit or whatever, but it's really hard. And so then they'll go back and they're like, oh, I'm gonna take like the last dosage I used to take, and then that's when issues happen with ODs. Is one of the ways. Leads to hypotension because the heart, and it's like morphine's a cardiac med we give, and it dilates. It's kind of like nitro, it dilates that vasculature. So although seizures are uncommon, they can occur like in any med. They become sedated or unconscious, and they have that pinpoint pupil, and they become cyanotic because they're not being oxygenated right. So they'll get around their lips or nose, and their fingertips will become blue. So naloxone is the reversal agent. Does anybody remember what kind of class naloxone is? It kicks it out, the opioid, off the opioid receptors. Starts with an A.
Antagonistic.
And antagonistic. Yep. It takes it off, like kicks the opioid, like the fentanyl, off the receptor. And so like when somebody's pretty, like their agonal respirations, it's pretty slow. So most commonly now they give intranasal. Yeah, in some areas lay people are permitted. Like it's pretty. Like you can walk into an ER or pharmacy and like I want naloxone and they'll just give it to you. There's no questions asked. And actually, my wife, who I said was a school nurse, she just told me about a program that they are doing where it's kind of like an AED. They just have like a case and there's a PO, I mean, excuse me, NP, the nasal naloxone, and somebody just can go whatever, just go grab it and take it. And they'll just replace it, like the hospital replaces it. I guess it's a controversy, but whatever. If it saves a life. So barbiturates are benzos. So like the Valium is a benzo. Again, it's a depressant. Versed of Ativan. They kind of feel peaceful and intoxicated. It's a depressant, so it's kind of like the alcohol. They're like slow, like you can talk to them, like have a conversation, but they'll be on their previous sentence while they're not there. And like they'll just be slow to respond with everything. Generally people take these by mouth. There are IV as meds. They have Versed that is given like through the nose, or diazepam, which can be given rectally for seizure patients. But like if they overdo it, and like Ativan takes a long time to get out of your system. And again, make sure the airway is patent. Like even if there is a reversal for Ativan, but it's really expensive and we don't carry it off the ambulance. And I can't remember off the top of my head, but so like we're just gonna do the head tilt, chin lift, make sure that airway is open, and provide BVMs if we have to. Or if they are breathing, we just can give nasal or nasal cannula or non-rebreather. So inhalants. I went to an overdose where there was like like I've never seen anything. Like they had like these little contraptions they put on paint cans, and I'm like, that was insane. But apparently, what really did him in was the fentanyl patches that he ingested. But yeah, so people do use inhalants for that high, like acetone, which is like nail polish remover. I don't really know what the rest of these are. So like glues, cleaning compounds, paint thinners. So teenagers, I guess, generally use these more because they can't get their hands on other drugs or yet. So they're warming up with what they can. Halogenated hydrocarbon make the hearts hypersensitive to its own adrenaline. So I guess if they take whatever that is, they like if they're gonna excrete adrenaline from their adrenal glands, and then it's gonna be like increase the heart rate and the blood pressure. And you want to keep the patient, you want to talk to them the best you can and talk them down. Everything's okay. We're gonna take care of you, like that. Just be gentle, slow, and talk about where you're going, calming as much as you can. Get ALS. Hydrogen sulfide. So highly toxic colors, inflammable gas, rotten eggs odor. Oh, this is I think bleach and the ammonia cleaning, and it's toxic. You can like just put yourself in a bathroom and put this in a pail, and away you go. And you have to break windows, and like hazmat teams have to go in to clear it out and get the patient out for recovery. Anybody read the book A Child Called It? Yes, it's about child abuse. And then like I was horrified through it. Then I'm like, one of the things that she did, the mother did to abuse the kid was like pour bleach and ammonia in like a bathroom with this kid, and he'd like do these weird things to survive. I'm like, that wouldn't work. And I found out the book was completely
Series
fake.
was tragic.
Yeah,
Oh, it's terrible.
but it's a toxic. It's like something you can't. He would be. It's horrible. It is horrible. That book was like, oh my god. So nausea, vomiting, confusion, because you're going to be oxygen depleted, and cardiopulmonary arrest. So it's cardiac arrest. Once the patient is decontaminated, management is largely supportive. So we're going to support cardiovascular function. We're going to breathe for the patient, and if we need to, start CPR and provide rapid transport, loss of oxygen. So sympathomimetics. So mimetic. This is like it's a class of drugs that kind of like mimic what our body does, like excretes on its own for adrenaline. But it's fake. Like let me think. Atropine's a sympathomimetic. So, but Molly is like synthetic weed, amphetamines, cocaine, like all this good stuff. Like we don't see a lot of most of this. I've only seen Molly once, and it's not very popular. Cocaine is like a high class drug. Like a lot of this deals with demographics of the patients as well. Like we in Berlin, we deal a lot with opioids, mostly, and meth. We have some meth. So they kind of produce an exaggerated, like excited state. They're just like anything that you would like if you get the fight or flight syndrome. Like they're going to be tachycardic, hypertensive. Their pupils, unlike the opioids or pinpoint, the pupils are going to be dilated. They're going to like look like you're not going to miss their pupils.
Take a look at the handout I sent you guys.
Oh, you sent you.
I put it in the chat group also. Toxidrums. I created a handout.
So
a lot of that's what they're covering.
Oh,
I'm
is
sorry,
it?
where did you put it, Kevin?
I emailed it to you, and I also put it in the chat group for this lecture.
Oh my god.
I think Jason got it.
Jason wants
It
to be
was in
done.
the chat. In the chat.
Yeah, it's in the chat, and then I also emailed it. Morgan, you probably have it in your email too.
Okay.
But yeah,
How much do you want me to post? Like, keep going, or how much more do we have? Oh my god, I didn't realize.
yeah, it's already after 10.
Yeah, probably 40. Well, we had 40 more slides.
All right,
That
I'll just
also-
finish up.
Does that
Oh,
also
sorry.
include the questions at the end?
Just getting to those
The-
30
like
questions.
20 plus slides are usually the questions at the end. That's why.
We got quite a few. Yeah, we can finish up sympathomimetic and then move on. Is that all right with you, Kevin, or do you want me to finish it?
It's up to the class what they want to do. It's after 10 o'clock, so
Yeah.
we've had them for 4 hours.
I have a really early day, like 4 in the morning.
Yeah.
Okay.
I'm sorry. I just
No,
Okay.
that's fine. We can pick up on this another day too, and just kind of. But I mean, the quizzes are already set, so kind of review the rest of this stuff here, and then we'll try to make it up on Thursday. I'll see if Zach can kind of just finish up on it.
Thank
So this, if you just want to finish up some pathomimetics, you have what, 2 more slides left?
Yeah.
Then we should be good. But I'll let him know.
Sure. Yeah. Sorry. Like, it's, I know cardiac's heavy, but so cocaine can be taken in different ways. Like, you usually the most is it's snorted. Yeah, and I guess they can smoke it as well. Like,
Crack, I think it's called.
yeah.
From what I was reading in the book. Not that I do it.
Sure. Like I saw in Berlin, people will do coke or some sort of stimulant when they do an opioid. So, but they're kind of hyper, but they're also kind of sleeping at the same time. It's really weird. An acute overdose is a genuine emergency. There's definitely going to be dysrhythmias because it's really messing with their heart, and it can cause stroke because it's going to increase their blood pressure as well. And there's high risk of seizures. A lot of patients can experience hallucination and paranoia. And do not ever leave a patient. Well, you should never leave a patient unattended, anyways, and provide transport immediately, where they can manage supportive measures. Ooh, Basol's my favorite. Okay, yeah, we'll cut loose. I'm sorry, we're running over and people are falling asleep.
As
couldn't
fun as
believe this
bath salts may be.
salts. When I was reading about this, I thought like there's some states that are still selling this legally. Like, it's so weird. It's such a bad thing.
Bath
And,
salts?
yeah,
I bet it's not
it's-
legally.
Only if
The
you
only
eat it.
medications
Yeah.
that works for this is Versed.
Yep.
Lots and lots of Versed.
So
But I'm going to stop the recording. So the only recording you guys won't have on there will be toxicology, but I'll find a previous class that I did and put it up there for you.
Okay.